Okay, so who is Jason Watler? Jason Watler is me, also known as Jay. I'm a public health advocate, writer, and community strategist dedicated to transforming how we talk about HIV, sexuality, and wellness in queer and trans communities. I have a strong background in HIV stigma reduction, PrEP advocacy, healing, affirming affirming health and education. I spent years creating spaces for LGBTQ plus folks to access care and connection without judgment. I've written and I've been published on thebody.com, and my perspectives has been featured on The Advocate. And I champion truth-telling, liberation, and sex positivity on one's own terms. I am grounded, my work is grounded in beliefs that queer and trans people deserve not only safety, but joy, not only representation, but empowerment, not only inclusion, but autonomy. I am a fierce advocate for community-led solutions and radical authenticity. I bring a blend of vulnerability, expertise, cultural insight to every conversation. My mission is to simply help our community reclaim our stories, our pleasure, and our power. So what we're going to talk about and explore today, we'll be exploring stigmas, resilience, empowerment, and tools that you can use to be able to navigate throughout our systems. Um, that we face every day, especially during these times when there's a lot of rollback. And I think a lot of things that you will see is that our system it's been designed in this way to not serve the people in a way systemic. So yeah, we're going to talk about realities of stigma, realities in the trans community, narrative shifts, and tools for our collective liberation. And if you have questions, concerns, or want to voice something, please let the you can put voice in the chat box, and then if someone has something to say, we can definitely make time for them to make time for us to have those conversations because I don't want to just be me talking. I want to talk. I want to talk. I want everybody to be able to voice something. Next one. All right. So let's setting the tone. So let's ground ourselves. What is one word that represents strength? Share if you would like.
Jason, they're asking if you
Mhm.
could please repeat the question and
Sure.
if it you can put it on the screen too.
Okay. Is it do y'all see the setting the tone slide or do they see it?
It says, "Who is Jason Walter?"
Oh, okay. Ooh, okay, then let me just go back. Who is Jason Wilder? Okay, I'll do it like this. I'll have it on here, and then, uh, all right. So yes, what we'll explore today, realities of stigma, um, the realities of stigma, resilience in trans communities, narrative shifts, and tools for our collective liberation. Um, see what else, especially for the next. Um, mm, sorry, technical difficulties. So the question is, I just have my notes. No, I just lost my notes. That's crazy. Uh, so yes, for the question is, let's ground ourselves. One word that represents strength. Please share if you would like. Someone put a cloud in the comment. Yes, one word that represents strength. Hmm. Hmm. Okay, so I see a lot of comments coming in. Okay. Yes, resilience, unity, okay, unity, empathy, community, hope, connection, power, unity, connection. Yes. So I definitely love what everybody's put, solidarity, of course. And these is peace, exactly that. These are definitely words, especially straight from numbers, vulnerability. These are words and phrases that has kept us together since the dawn of time. I think that we have all have to lean on being vulnerable with one another, with one another um, being staying resilient. And sometimes honestly for me I can even feel tired. I get tired of being resilient all the time. It's tiring. So there is times that I do have to fall back and have to kind of just preserve myself, but also there's times where that's when I do have to fall back, I fall back onto my community, my friends, my chosen family, my and I think those are things that we a lot of us practice very, very well. So if anything, I hope my presentation will be a refresher and also just I hope my presentation today will be of a not just a refresher, but also a reminder of love. Um, so to the next, where is it? Can everyone see the what we're against slide?
The slide it's on now is setting the tone.
Setting the tone.
Uh-huh.
Okay, we're just going to work through this. Mm, okay, so what we're up against. So what we're up against. So these are these a lot of the stuff that we dealt with. Before we talk about empowerment, we have to be honest about the realities that trans and gender expansive people are facing every single day. These aren't theoretical ideas. They are lived experience that shape how people access care, how they move through the world, and how safe they feel in their own bodies. When we talk about what we're up against, we're really talking about overlapping forms of stigma, structural, healthcare related, cultural. These systems don't operate in isolation. They stack, they compound, and they interact in ways that directly impact health and our well-being. Structural stigma shows up in policies, laws, and institutional practices that make it harder for trans people to live freely. Things like insurance barriers, anti-trans legislation, employment and housing discrimination, and unequal protections under the law. These are the conditions that shape possibilities, who gets access, who gets denied, and who gets left out entirely. So when I think about that, it comes to I think of like a lot of gender affirming care. I've seen an article about cisgender men getting top surgery or getting fat removed from their chest or can you reshare the deck into a full screen? Oh, y'all see my notes. Do they see my notes now?
Yeah, your notes are showing. So
Yeah. Uh, let me just 1 second.
no
Share.
worries.
Mm, full screen content always back on the shoulder. Presenter. Listen to.
Yes, thank you for finding Zoom for us. Exactly. Yes.
Mm,
So what you're going to do is you're going to press X, where
mhm,
it's, yeah, there you go.
right. So when I think about that, I think about like in ways that even the term gender affirming care everyone gets gender affirming care. Essentially, people get top surgery, people get, breast augmentation, breast reduction. People get, um, I've seen an article about cisgender men getting essentially breast reduction, chest reduction, um, and so on and so on. But when you slap trans in front of it, that's where the red tape, and that's where the red tapes and the stigma comes into play. That's when, oh, are you sure? The whole things of like, are you sure this is what you want? And then when you bring youth into the mix, it gets even more sticky. So, especially for trans youth into the mix of things. What are some can you also place in the comments about like any sort of stigmas that you have faced and any sort of stigmas that you have faced trying to receive gender affirming care, or maybe like friend, if you know of a situation where a friend of a friend, they're trying to receive gender affirming care. Electrolysis. Ooh, what is that? Is that like facial hair removal?
Yes.
Okay, okay, gotcha. Hair removal. Okay. I like because I had to remember. Then I also remember one of my friends going to one of my friends' appointments for their electrolysis. They said, I guess laser hair removal. But yeah. Any other examples? Does not necessarily mean face only. Yes, exactly, exactly. And what about anything with like and I think when we talk about structural stigma, we gotta think about, getting your name changed. That's a hot topic that is in going on. Um that's a hot topic that's going on with a lot of, especially if you live in America, which whew, just it's been a lot. It's been a lot going on. Someone also stated, before I started transitioning, a nurse told me a lot of people transition because it's trendy. And also at the word I stayed at, a nurse asked if I could just be a gay girl. Whew. Mm. I've heard that before. I've heard something similar before. One of the places that one of the community organizations, not that I worked at, but I was visiting. Um, just and also that is definitely bad. Someone's also said bad nursing. Yes. Someone I was around, they made a comment. It was I used to live in Richmond, Virginia. And it was a photo that went online that was popular, and it was three black persons. They all got their top surgery at the same time. They all had the bandages and then the drip tubes and the drainage and everything. It went viral. I was loving it. I was like, wow, like, from the city that I'm living in and everything, that, it was a lot of that. But then I remember a comment I heard was that, oh, people are just doing that because it's trendy. And I'm like, trendy? tr it's a lot of things people do that is trendy. I think we have to like really just be careful, especially with those words, because there's a lot of things that cisgender people that does is trendy. BBLs, um, lots of we all engage in some sort of modifications to feel our best selves. Now, whether we have to reverse some of those modifications or whatever, is still something that we do for gender affirming care. Chris Moyer said, trendy equals accessible now when it wasn't before. Exactly, 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 exactly. I love that. I really, really do. And I think, especially with a lot of things, when things become more accessible, especially to everyone, I do see how cisgender folks, they start to get like on edge about it. And it's really, really it really shows the power and dynamics between, cis and trans. And that's why we have to call things a thing. Um, Someone said, Olivia Jeter said, mine isn't people believing the prefix trans mean transition and claiming I'm not trans because I haven't received enough gender affirming care. It's so false. Exactly, exactly. And it's unfortunate because not everybody, there's no right or wrong way to be trans, and I wish people could really put their eyes on that. Not everybody wants gender affirming, or is not everyone gets the same gender affirming care in general, cis or trans. Like it's no one way to be trans. Um, Let me see, trans medicalism, exactly. So let me go to the next slide, and let me see if I can pull my notes up for the oh my God. My total against structural barriers. Okay, got it. So when we talk about structural barriers, sorry, I'm gonna move this out of the way. When we talk about structural barriers, when we talk about stigmas at a structural level, we are talking about the systems and policies that shape people into daily lives long before they even walk into a clinic or sit down with a provider. Um, the structural barriers are built into institutions around us. They determine what resources people can access and how easy or difficult it is to navigate services, and whether the world meets trans people with support or resistance. So again, what we were talking about earlier is a lot of when it's a cis person getting the services, it's going to be support. But when it's a trans person getting the services, it's going to be met with resistance. Are you really trans? Are you really this? Are you really, are you just like someone said in the comments, are you really just a gay boy, a gay girl that's just masculine center? It's really all those things, and those things are meant to not, those are very harmful, and those are things that is, again, all they want to prevent us from being our true selves. Are you really just because you gotten hormone replacement, HRT, or so on and so on? When cisgender people get the same surgeries, if a cis man has low levels of T, he gets placed on testosterone. And I know plenty of cis men that is on T, or even when a lot of bodybuilders are doing their, fitness regimens, they may get on T or any sort of testosterone that, can really amp them up to the next level. Again, gender affirming care. But when you slap trans onto it, that's where the issues become in the line. One of the clearest examples is insurance discrimination. Even today, many insurance companies deny or complicate access to gender affirming care, not because it isn't medically necessary, but because stigma is outdated. Policies still shape how coverage decisions are made. That this forces many trans people to delay care, pay out of pocket, or fight endless appeals that take time, money, and emotional energy. We also see structural barriers in limiting access to gender affirming providers. In many regions, there simply aren't enough trained clinicians who understand trans health, or the wait lists are months, sometimes years long, sometimes years long. Geography becomes density. Your zip code can determine whether you have care or don't. And I think one of the things, and one of the ways that we get around that is a lot of telehealth, and Plume Clinic also has telehealth providers, so that's one way we can get around it. But also, what happens when you want to get a gender affirming care and surgery, who are you going to get linked to? What if you're in a far rural area? I live in Washington, D.C. There's clinics and providers are everywhere, especially culturally competent providers. But what if you're living in, let's just say, in a border between rural areas like West Virginia and Western Virginia, like outside of Roanoke, or in like just places where you have to drive 50 miles or more to go to a doctor. So um it really becomes really, when we think about stuff like that, it really becomes like it really, really just all that. Yeah. Let me see what the comments are saying. I did test as a cis male. I did T as a cis male for 3 years. Okay, awesome. Wow. Um, Insurance companies value over people's health. Exactly. Um, Next we have employment and housing instability, which I have my own fair share of both of those. Um, because of workplace discrimination, hiring biases, and the challenges of navigating unsupportive environments, trans people experience higher rate of job loss, under underemployment, and housing insecurity. These create conditions of a domino effect. When housing is unstable, everything becomes everything else becomes harder. Accessing medication, storing hormones, keeping employment, staying safe, maintaining mental well-being. So it's again, the system definitely was made to be unstable for us, but stable for cis folks. And then there's anti-trans legislation. And I feel as though is always some sort of legislative always being pushed. When this remember this, when they're talking about an agenda and they want to put us on the front of the trans agenda, guess who makes all the legislations? And it's usually a cis person. So what's the real agenda is cis heteronormativity. Um hold on, let me see. Yes, there isn't one, and going back to the comments, there isn't one way to transition. Also needs to stop with the binary thing, and plenty of us wants to move forward for ourselves, not for massive family. Yes, someone said in the comments, also we need to stop with the binary thinking. Plenty of us only wants to move towards ourselves, not from mass to femme or femme to mass, MB groups. Yes, exactly. I have many friends who are definitely, I'm not binary myself, but I have a lot of other NB friends who still want to get on HRT, but they want to have the vision or move towards the vision of themselves, maybe more softer, maybe a little bit more, maybe a little bit more other different kinds of features to know what, it's not always the hyper feminine or the hyper masculine. There is the in between. There is outside the box. It's very much like transitioning. Remember, our transition is for us, not for the appeal of them. And yes, a lot of us, when we transition, it is out of survival. It is. It is out of survival. Anti-trans legislation is designed to distract the majority of people from the fact that they are stripping away everyone's access and rights. Thank you. Thank you. Thank you so much, Chris, for your exactly androgyny, baby. Yes. Some people, we don't all have the same goals. We're different people. We are not a monolith. We all have different dreams, goals, aspirations, which is shaped by culture, which is shaped by how we were raised, which is shaped by where we grew up at, which is shaped by a whole slew of other things. Um, um, when we look at these factors together, it becomes clear structural barriers aren't about individual choices. They're about the environment people are forced to navigate. They decide who gets support and who gets excluded, who gets the care they deserve, and who has to fight to exist. Hello, most of us on here has we have to fight to exist. My goal is naming these barriers is not to overwhelm us, but to ground us in reality. Because when we understand the system working against trans people, we can better understand the system program and advocacies that work for them. Intersectionality. And intersectionality is, I know it's thrown around as a buzzword. It was coined by Professor Kimberly Crenshaw. Um, and it basically makes room for we are not all, like I said, a monolith. We all have our own things going on. For me, I am a Black, queer, non-binary individual. So I do face homophobia and anti-blackness, and I can face that at the same time. There are things that I've gone through in my life where it can be one or the other or any sort of thing at the same time. I'm also neurodivergent. So that's also another barrier in the structure. But also I appear as a cis man. So that is sort of a, like for me, that is sort of a privilege, and I can use that to my advantage to also further the trans, quote unquote, the trans agenda, which the trans agenda is for everyone to have access to care and resources to also, so there's things that I do use my privileges, my own privileges for, especially for my peoples. Next one. So when it comes to healthcare and stigma, excuse me. Um, so healthcare stigma, we've we've seen a lot of things, especially over the past few weeks, with healthcare stigma, and even for cisgendered women, especially black cisgender women. I believe a lot of us may have seen a a woman struggling that obviously she's in labor and she's on a wheelchair and she is literally like not given the attention that she needs. Why is she being triaged? And the why is she being triaged? Which y'all need to take her to the back so she can have her baby. So there's a lot of like healthcare stigma that, and again, please recognize intersectionality because these are things that all coincide together. Everything connects and coincides together because we are human. Um, so a lot of times, a lot of people have dealt with, misgendering, dead naming, care refusal, provider biases. So when you go to a provider who is culturally competent, 9 times out of 10, you may or may not have to deal with any of those things, or if you do experience those things, you may have the power to either report, get that thing checked or fixed, or be able to have power to do that. But if you're not in a going to a provider or a hospital system that is not culturally competent, then it's just very much you might not even want to go in. You might not even want to get seen because of you might not even want to get seen because you already know that I'm not going to be respected as a human. I'm not even going to be seen. They're going to look at me like I'm a quote unquote, and I'm going to use this word loosely, a freak project. No one doesn't want to be looked at those ways when they get their care. Even if it's not even a gender, something gender affirming care, you're just trying to get seen because you're sick. You're just trying to get seen because you're having the flu or you're experiencing symptoms of pneumonia. But then you go into a provider who is not culturally competent, they're like, oh, well, who are you? And you're trans and all that type of stuff. So it's kind of just like, and with stigma, a, when there's smoke, there's fire. When there's stigma, there's discrimination. And then when there's discrimination, you have biases and laws and policies and all of these things that make it harder for us to get care, make it harder for us to be seen, make it harder for us to be heard. And I think that a lot of cisgender people can recognize, which when you are like me, when you're, African American, Black, I just watched something where a provider was breaking down Black people that get high blood pressure. A lot of us been misdiagnosed as they think that because they're black and then the environment and everything, like a lot of us been misdiagnosed with that, and a lot of us probably there's basically a way for it to do it for everybody, if that makes sense. um Let me see what Ileana said. What I cannot understand is what others gain from taking away from us. This is not a pie. If I take a slice, it is one less for you. There is one less for you. It is oxygen. Everyone gets it, and my taking of it doesn't lessen yours. Exactly, exactly, exactly. And I think it's because the reason why the scarcity mindset is because of capitalism. It is because of capitalism, full stop. With capitalism, it creates the scarcity that, oh, if someone has XYZ ABC, you don't have it. If you get what I mean. When actually we all can eat at the same table. Let me go into the jealousy, superiority, complex power, irrational fear, also fear, exactly. And all, this is again, this is all systemic. This is all intentional. This is all intentional. So now how many minutes I have? Because I know I'm I'm not even halfway through. I'll just keep going.
15.
15. Okay, we're gonna just speed rush through this. Oh Lord. Cultural is social and cultural stigma. So again, with dealing with media harm, family rejection, safety concerns, policing genders, those are things that is on the plate. Deal with a lot of, a lot of posts that's made about us, but not made with us in mind, but made about us, where just being talked about, but not we're being talked about, made fun of online, which breeds more stigma. Um, Impact on health and wellness, delayed care, mental health strain, chronic stress, increased vulnerability. Um, Let me see what else. And remind me, I'm just gonna have to speed run through this because I don't. Oh, there's where is it? Yeah, where is my notes? That's here it is. Um, Tools for collective liberation. Understanding liberation in queer and trans community. When understanding liberation, it's crucial to recognize that queer and trans individuals have never relied on institutions for salvation. Our communities have consistently developed the tools, networking, and cultural struggles, essential strategies essential for survival. What we refer to as liberation work is not a novel concept. It embodies lineage and legacy. Liberation is not just a future we aspire to. It is a present reality that we have been cultivating for decades through our love, resistance, and care for one another. So when I think of how we show up and care for one another, here's kind of the things, for me as a Black queer person that has helped, or we've done all together. We have drag houses, we got ballroom, we have these spaces that centers us in mind, that has done those works of creating chosen family, that has, done those things. And so when we talk about that, let's talk about resilience in action, our creativity, leadership, and community power. Um, so when you think of resilience in action, um, when it comes to so when you think of, well, let's talk about community power. So when you think of community power, what are things that you think of, or what are, if y'all can put it into the comments as well? Like, what's the main thing that our community does to come together, literally, this support? Pride parades, yes, we show up and show out at our pride parades. Love it. And also, pride is a protest. It's still a protest. Pride is a protest, y'all. It's we have the parades, but like it's pride is a riot. Just especially how it started back then at Stonewall to now. Yes, the word I was looking for, mutual aid, creating safe spaces for sharing without threat of calling any authority or deferring to power. Yes, definitely mutual aid is something that we definitely do. And that is one thing that we do to definitely raise awareness funds. So definitely, and just not feeling alone, understanding exactly that as well. We've also, in a lot of us, especially younger, or no, let me not say that. A lot of us have found space on online in communities like this, communities like Facebook, Tumblr, Instagram, Twitter, Snapchat. We found We found community with each other in the groups, in the following one another. So we don't, so we can feel less alone. We feel, especially growing up, queer and trans and growing up queer and trans is at times can be isolating, especially years back, 15 years back, 20 years back, especially when we done a lot of us didn't have the autonomy from to steal a phrase, Liana said, to steal a phrase from uh what was a negative mutual aid society. And even with that, and mutual aid is goes far as back as mutual aid, mutual support. You can find that in the many revolutionary movements, but the Black Panther movement. That's why they were afraid of the Black Panthers. The United States government was afraid of the Black Panthers because they were becoming and teaching self-reliant, reliant on the community. We get the resources and disperse it into our communities. We get the resources to, the free lunch, the free breakfast programs, the health and wellness, all of those things. So those are things that we have to definitely center and really center and push more because that's the stuff that we need and have relied on. This is who we are. So I want to definitely touch on mutual aid aspects right quick for community innovation. Mutual aid is one of the most powerful tools that we have, and it comes directly from queer and trans cultures long before nonprofits or health departments created programs. Our communities were doing the work. So, a lot of times, sharing hormones, information, and safety tips, raising money for rent parties, and that's even, having a rent party that's a lot of folks in Harlem, throughout the South. We all have had, rent parties. That's nothing new. Rent parties for raising rent, surgeries, and emergencies. We always post our GoFundMe's for the goals that we want, our surgeries, or we need an automobile, we need to get to XYZ, we need to get from one place to another. Mutual aid for having a safe trip for an important trip for an abortion, um, creating food circles, ride share, and clothes swaps, and protecting each other when family or systems wouldn't. Mutual aid is liberation because it says we will not let each other fall. They fought the passage by bringing drugs into the community. Yep. It's and a lot of these things are, Oliver said it can be hard connecting with the community sometimes because a lot of some of us face mental health challenges because the system can take it out on each other. Exactly, exactly. I definitely want to hit on the chosen family structure. Chosen family is one of the profound political, spiritual tools we've created when the world says our relationship wasn't legitimate. We build our own families rooted in affirmation, care, and joy and survival. Chosen family is liberation in action. It shifts power. It redefines support. It teaches us that belonging to something you're given, it's something that you cultivate. And for me, especially the times I've been going through, I've had to, my chosen family has came through, stepped up for me when I needed them the most. I wouldn't be, I A lot of the resources within Washington, D.C. over maybe if you asked, a few years ago, I would be able to, lean on the system a little bit, but a lot of those safety nets have been pulled. So I have to rely on my chosen family to be able to have a safe space to stay. And I wouldn't be here without my chosen family. Um, and then storytelling as resistance. So a lot of um our stories of queer and trans people has always used storytelling to make sense of ourselves, to heal, to resist erasure, to affirm our existence. Ballroom culture, zines, nightlife, spoken word, digital spaces, podcasts like my own podcast, The Guys Named by Jay, are tools of liberation, centering ourselves, our stories, our lived experiences, our magic. Creating storytelling is what is one of the ways that we survive. Storytelling is how we name our realities, challenges, and stigmas, shift narratives, and imagine a world where we are free. So, list below, what's your favorite podcast that makes you feel seen, heard, or validated? It can validated. Just list that in the comments below because I definitely want to find some new podcasts to listen to. Gender reveals great. Yes. Um, a little bit fruity. Okay. And I think I may have to speed this up as well. I may have to hop so many. I really hate this is becoming really short. Um, and then last but not least, pleasure, joy, and sex positivity as radical tools. Liberation is not about surviving, it's about thriving. Pleasure, joy, and sex positivity are tools of political resistance. They challenge shame, they disrupt puritanical norms. They affirm that our bodies belong to us. To experience joy in a world that tells you not to exist is an act of defiance. To claim your sexuality and desire on your terms is an act of liberation. And I'm gonna have to skip a lot of this other type of stuff. Again, we have to center our expertise and experiences. So, getting more of us into leadership so that we can bring in the the next people coming up behind us. Yeah, 5 minutes is hard at a time. Let me know that I need this working. Okay, so we are running out of time, sadly, and I wish, I mean, if y'all want me to do this presentation again, I'm more than well, we can set aside time for that. But if you want to, and I would like to be able to do it like, more longer, but we only have a certain amount of time. Um, so for me, I would definitely say definitely Plume is definitely a good resource to be able to get a lot of stuff done, and especially for a lot of trans healthcare. There's so many people out here providing care online virtually because that's one thing that brings us all together. But this is PlumeCon 2025. So if you're not enrolled in Plume Clinic, you should get enrolled because it's really, really great from what I've heard. And the last thing I want to say is let's celebrate not just being loud and proud, but the quiet, the brave, and the everyday acts of being. Give yourself a round of applause for actually being here, coming here today, showing up for yourself. Um, and my whole thing is let's be more unapologetic. And if you want to keep up with me, if you want to keep up with me and my wild ways, you can follow me on LinkedIn at Jason Watler, the T before the L. And you can follow my Instagram, my podcast Instagram, The Gathering by Jay. And then also my regular Instagram as told by Jay underscore. So you can follow me at those things. Let me put it in the comments. Let me put it in the LinkedIn. I'll just put LK, my name, Jason Butler. And then um podcast IG. And also if you want to hop on the podcast, hit me up. I definitely would love to. We're gonna chat and bring truth to power on my podcast by Jay. And then my Instagram, main IG. Sorry, Jay. Again, I'm so sorry it's been rushed, but we are on a limited timing. But there's other amazing, just like myself, we're all presenting today. And I'm so happy that everybody was able to join me today and work through the hurdles of our stuff, especially for technology stuff. But we're here, and I'm so happy that to be presenting at PlumeCon. So thank y'all so much, and I hope that y'all will be able to join me soon. And we can have this presentation again. Okay, thank y'all so much. All right, shall I stop sharing, Chanel? I'll stop sharing.
Yeah. Thank you so much, everyone, for joining. I hope everyone enjoys the rest of your day. And I look forward to seeing many of you tomorrow. Because this is my last session of the day. And Jason, thank you so much for everything. Have a wonderful and beautiful day, everyone. Take care. Bye bye.